Block 1. The Radical Vision of Dr. Sara Josephine Baker, July 1908. The air in Hell's Kitchen, New York, is thick enough to chew. It's a foul cocktail of coal smoke, unwashed bodies, horse manure, and the cloying sweetness of decay rising from the gutters. In a cramped third-floor tenement, a mother watches her infant son fade. His cries have weakened to whimpers. The diagnosis is the same one whispered in 1,000 other apartments that week: summer complaint. A fatalistic euphemism for the dysentery and dehydration that claimed 1,500 babies every single week during the city's sweltering summers. The prevailing medical wisdom offered little more than a shrug. It was seen as a tragic but inevitable culling, nature's cruel arithmetic. Into this suffocating despair walks a physician from the New York City Department of Health. She is not what the family expects. She is calm, observant, and she is a woman, Dr. Sara Josephine Baker. She doesn't offer a useless patent medicine or a prayer. Instead, she asks questions no one else is asking. Where do you get your milk? How do you store it? Show me how you wash the baby's clothes. These were not the questions of a traditional doctor. They were the questions of an investigator at a crime scene. And for Baker, that's exactly what this was. At the turn of the 20th century, New York City was a marvel of modernity and a pit of medieval squalor. While skyscrapers clawed at the clouds, the infant mortality rate in neighborhoods like Hell's Kitchen rivaled that of the most impoverished nations on earth. 1 in 6 infants born in the city died before their first birthday. The medical establishment, an exclusive club of men, largely attributed these deaths to 2 things: inherent weakness in the immigrant population or divine will. They treated the sickest children with ineffective tonics, focusing their efforts on individual cures long after the battle was lost. Baker saw this not as a series of isolated tragedies, but as a systemic failure of public health. A graduate of the Women's Medical College of the New York Infirmary, she had seen the carnage firsthand. She understood that the true pathogens weren't just microbes, but poverty, ignorance, and policy. She believed in a radical, almost heretical idea for the time, that it was more effective, more humane, and ultimately more scientific to keep a baby from getting sick than to try and save them after they were already dying. This conviction put her on a direct collision course with the medical patriarchy. In 1907, she was appointed assistant to the health commissioner, a role she took on with a singular mission. She presented a meticulously researched proposal to form a new division, one dedicated entirely to preventative care for children. Her male colleagues were openly contemptuous. They derided her focus on hygiene, nutrition, and maternal education as social work, not real medicine. One prominent physician scoffed that you couldn't change the behavior of ignorant tenement mothers. They argued that her plan was an expensive boondoggle that interfered with the natural order. But Baker had an unassailable weapon: data. She had mapped the deaths block by block. She had correlated mortality rates with access to clean ice, with the presence of houseflies, with the source of the family's milk. Her evidence was so overwhelming that in 1908, the city reluctantly established the Bureau of Child Hygiene, the first such government agency in the world. And they made Dr. Baker its director, perhaps assuming she would quietly fail. They underestimated her completely. With a small budget and a team of 30 nurses, Baker launched a full-scale assault on infant mortality. She established milk stations, which were quickly rebranded as baby health stations to broaden their scope. Here, mothers received free health screenings for their babies and, crucially, education. Nurses, trained by Baker, demonstrated how to pasteurize milk at home. They taught the importance of hand washing, of protecting food from flies, of proper bathing techniques. They dispatched visiting nurses into the tenements, an army of public health soldiers going door to door. They developed a comprehensive program for school health, implementing regular checkups to catch and treat contagious diseases like trachoma and ringworm before they could sweep through classrooms. This wasn't just about handing out pamphlets. It was an active, hands-on intervention into the daily lives of the city's most vulnerable. The resistance was immediate. Some families were suspicious. Some landlords tried to block the nurses from entering their buildings. And the male-dominated medical establishment continued to snipe from the sidelines, dismissing her work as coddling the poor. But the results silenced them. In the first year, in a district where Baker's programs were fully implemented, the infant death rate dropped precipitously. By 1911, New York City recorded 125 infant deaths per 1,000 live births, a dramatic reduction. By the end of her tenure, that number would be lower than in any other major American or European city. She had saved thousands of lives with nothing more than soap, education, and the radical belief that every child had a right to survive. Her success was undeniable, a triumph of science and compassion. But would this quiet revolution be enough to earn her the authority she deserved, or would a new, terrifying public health threat force her methods into a brutal public spotlight? Following those quiet triumphs in the tenements, a public battle emerged that would forever attach Dr. Baker's name to one of history's most infamous disease carriers. The story begins not in a slum, but in a lavish summer home in Oyster Bay, Long Island, in the summer of 1906. 6 of the 11 people in the household of wealthy banker Charles Warren fell gravely ill with typhoid fever. It was a disease of filth associated with contaminated water and poor sanitation, things unheard of in such an affluent setting. The owner, desperate and terrified, hired a sanitary engineer named George Soper to find the source. Soper, a self-styled epidemiological detective, tested the water, the pipes, the milk supply, and the local shellfish. He found nothing. The outbreak was a medical impossibility. Frustrated, Soper turned his attention to the human element. He discovered that just 3 weeks before the outbreak, the family had hired a new cook, a stout, strong Irish immigrant in her late 30s named Mary Mallon. As he dug into her employment history, a chilling pattern emerged. Between 1900 and 1907, Mallon had worked for 8 families. In 7 of them, typhoid had erupted, sickening 22 people and killing 1. The evidence was circumstantial but terrifying. Mary Mallon was a walking plague, a perfectly healthy person who shed deadly bacteria wherever she went. She was an asymptomatic carrier, a concept so new it was barely understood by the medical community, let alone the public. Soper tracked Mallon to a new job in a Park Avenue home. His confrontation was a disaster. He bluntly accused her of spreading disease and demanded samples of her blood, urine, and feces. Mallon, who felt perfectly healthy and saw this educated man as a persecutor of a poor working woman, was enraged. She denied everything and, according to Soper's own account, chased him out with a carving fork. His attempts had failed, and a public menace was still at large, working in a kitchen and preparing food for an unsuspecting family. Realizing he was out of his depth, Soper took his evidence to the New York City Health Department. The case landed on the desk of Dr. Sara Josephine Baker. Where Soper had seen a scientific puzzle to be solved with force, Baker saw a complex human and public health crisis. She understood the science implicitly, but she also understood the fear and distrust a person like Mary would feel. She decided to approach Mallon herself, hoping a woman-to-woman conversation grounded in explanation and empathy might succeed where Soper's aggression had failed. She found Mallon in the kitchen and tried to calmly explain the situation, that she was not sick, but she carried the germs that made others sick. She tried to convey that they wanted to help her, not punish her. But Mary's fear had already hardened into furious denial. To her, this was just another form of harassment from the authorities who governed every aspect of her life. The encounter escalated, and once again, Mary was defiant. At this point, Baker was faced with an ethical crossroads that would define public health law for the next century. On one hand was Mary Mallon's right to liberty, to work, and to control her own body. On the other was the health and safety of an entire city. Could the state forcibly detain a healthy person for the public good? The legal precedent was non-existent. Baker made the difficult decision. The risk was too great. She returned with several police officers and an ambulance. What followed was a chaotic scene. Malin, seeing them arrive, fled. She led them on a chase through neighboring properties, finally hiding in a small outdoor closet. It took them 5 hours to find her. As they pulled her out, she fought like a wildcat, Baker later wrote. Malin was taken to Willard Parker Hospital and forcibly tested. The results confirmed Soper's theory. Her gallbladder was teeming with Salmonella typhi. The press had a field day, dubbing her Typhoid Mary and painting her as a monstrous, unthinking villain. She was exiled to a quarantine cottage on North Brother Island, a patient prisoner. The case sparked a massive public debate about civil liberties, class prejudice, and the power of the state. Many felt her treatment was an unjust persecution of a poor immigrant woman, while others saw it as a necessary act of public protection. Baker, caught in the middle, never vilified Malin. She saw her as a victim of her own biology and a society that didn't know how to handle her. She later wrote with sympathy about Malin's lonely and confusing existence. The case, brutal as it was, proved the scientific reality of asymptomatic carriers and forced a revolution in food safety regulations and epidemiological tracking. But was containing one woman the real victory? For Baker, the ordeal was a stark reminder that public health wasn't just about germs, it was about systems. How do you fight a disease that lives not just in one person's gallbladder, but in the very fabric of an unequal society? The Typhoid Mary case thrust public health into the headlines, but Dr. Baker's most profound revolution was happening away from the media frenzy, in the quiet details of daily life. While the world was fixated on the quarantine of a single woman, Baker was busy saving children by the thousands, dismantling the systems that allowed disease to flourish in the first place. Her work went far beyond hygiene education. She was a relentless innovator, applying scientific principles to everyday problems with life-altering results. She saw that poor mothers, unable to breastfeed, were often forced to use unsafe and expensive commercial formulas, or worse, unpasteurized cow's milk. So she developed a safe, standardized infant formula using ingredients that were cheap and readily available: water, calcium carbonate, lactose, and pasteurized milk. The Bureau of Child Hygiene distributed the recipe and ingredients at their health stations, providing a lifeline that severed a major chain of infection and malnutrition. This wasn't just a recipe, it was a public health tool, a piece of applied science that empowered poor families to keep their children alive. Her genius was in seeing the big picture in the smallest details. She noticed that many infants, especially in cold tenements, died from respiratory illnesses because their restrictive, multi-layered clothing would get wet and stay damp, or they would kick off their blankets and become chilled. Her solution was breathtakingly simple and elegant. She designed a single, practical garment that allowed for freedom of movement while keeping the child warm and dry. It was, for all intents and purposes, the forerunner of the modern baby onesie. This wasn't about fashion, it was a medical device born from observation and empathy. Furthermore, she professionalized midwifery. Before her, midwives were unregulated, their practices a mix of folk wisdom and dangerous guesswork, contributing to high rates of maternal and infant mortality. Baker created a system for licensing and training them, integrating them into the public health framework and ensuring they followed sanitary procedures. Each of these innovations, the formula, the clothing, the licensing, was part of a holistic revolution in child welfare. By the time she was done, New York City, once one of the deadliest places for a child to be born, had the lowest infant mortality rate of any major city in the world. Yet, this unparalleled success did not translate into institutional respect. The system she worked within, a system run entirely by men, was happy to take credit for her results but refused to grant her the authority that should have come with them. She was, by every objective measure, the most qualified public health official in the country. She served as the Assistant Surgeon General of the United States during World War I. She was the first American woman to receive a doctorate in public health. When the position of New York City's health commissioner opened up, she was the obvious choice. But she was passed over again and again in favor of less qualified men. The political machine of Tammany Hall couldn't stomach a woman in such a powerful position. In her autobiography, Fighting for Life, she wrote with weary frankness about the stone wall of masculine opposition. They would praise her work in public, but in private they blocked her advancement. In 1923, after being overlooked for the top job one final time, she resigned. It was not a retirement. It was an act of protest against a system that would exploit her brilliance but deny her leadership. She was, in a very real sense, driven out by the establishment she had helped to build and legitimize. Her name is not on a hospital. Her face is not on a stamp. But her legacy is inscribed in the very DNA of modern society. The Bureau of Child Hygiene she created became the model for similar agencies in every state and dozens of countries. Her core principles, that public health must be preventative, data-driven, and focused on social determinants of health, are now the foundational tenets of epidemiology taught in every medical school. Global organizations like the World Health Organization and UNICEF are the direct philosophical descendants of the work she started in the slums of Hell's Kitchen. Her life is a powerful and often infuriating testament to what one person can achieve against systemic resistance. She fought for the radical idea that a child's chance at life should not be dictated by their parents' income or their address. She saw health not as a commodity but as a human right. Her story was nearly erased, a footnote in the sensational saga of Typhoid Mary. But her true legacy isn't in a single famous case. It's in the quiet, uncounted millions of lives that were lived because she fought for them.